Here at Hunter Valley Orthodontics, there are many different treatment options depending on the presenting malocclusion. Braces are by far the most popular, the most common, but Invisalign in recent years has become more popular. It is limited in what it can achieve. Generally, the more complex the malocclusion, the less Invisalign may be suitable, but it's a case-by-case basis. It's very popular with adult patients that are perhaps self-conscious about having braces on their teeth as adults. Invisalign is a product that aligns or straightens the teeth without the need to physically bond braces to the teeth. It's not invisible, but it's probably as close as you'll get to invisible. A series of clear plastic aligners are worn to put pressure on the teeth to make them move. I stress at the start, it's not a soft option to braces. It still requires a lot of compliance. The plates have to be worn 22 hours a day. They're taken out when you're eating, when you're brushing your teeth, and for a few social occasions. But at all other times they need to be worn. And if they're not worn for that period, then your results are going to suffer for that. If a patient decides to proceed with Invisalign, we take impressions of their teeth, or they can sometimes be scanned, sent to Invisalign, and a three-dimensional image of their teeth is produced. They then send us that record as what they call ClinCheck. We can check the position of the teeth, check how we want the teeth to move, the staging of treatment, and then we show the patient this ClinCheck final result for their approval. So they get to see before we start what their teeth are projected to look like. You still require some attachments on your teeth in most cases. Now these are not metal brackets, they are generally a tooth-coloured resin that we use to create a handle, what they call a precision attachment, that enables the plate to positively grip the tooth to move it correctly. And I think that's something that most people are not expecting, and we certainly show them what they look like and how they go on before they start. But it's not always possible to tell which teeth require those attachments or how many attachments are needed until the case is actually treatment planned. Treatment times with Invisalign are estimated to be about the same, at least the initial course of alignment. But toward the end, there is always a bit of fine-tuning that's needed, what they call case refinement. So we may need to take new models or new scans, resubmit for finishing aligners if the teeth have improved but not quite there. So overall, I'd have to say in my experience, the treatment may take a little bit longer for most cases, but in some cases it can be slightly shorter. With Invisalign, they certainly move teeth, and it's certainly brilliant, the technology that they have invested into this to be able to treat patients. But I generally find the quality of the finish you get is very good, but not quite as good as what most can achieve with braces. Particularly that slight rotation at the end, that slight tip to the tooth that a plastic plate not positively gripping or being attached to the tooth like braces can achieve. The cost of Invisalign does vary from patient to patient and case to case, but generally it is more expensive than conventional braces, often more expensive than ceramic or clear braces. But that's something to certainly discuss with the patient at the time. When it comes to deciding what appliance to use, often there is a range of choices, and we as your orthodontists would recommend one over another. If there is no difference, then certainly to the patient's choice. But often it comes down to a choice of a couple of modalities. One perhaps we may feel is better, but it really depends on the level of perfection, if that's the right word, that the patient's looking for, whether they can accept a slight compromise on the quality of the result for the convenience of having a removable plate over braces. But we would help them in that decision-making process as to what they feel is going to give them the best result.